Did you know that in low middle income countries, over 500,000 people die each year due to unsafe water, and 300,000 due to inadequate sanitation? Another 300,000 lives could be saved through better hand hygiene. This adds up to over 1 million deaths annually, making up to nearly 2% of the global disease burden. Different regions are affected differently, but there's limited information about the shift to better water sources and incomplete data on sanitation and hygiene. Measuring water security and insecurity is crucial. We need to understand the real experiences of communities, and tools like the Household Water Insecurity Experiences or the HY scale offer valuable insight into the community's lived experiences. By understanding their lived experiences and struggles, policymakers and stakeholders can create targeted interventions that address the root problems and promote sustainable and inclusive water security for all.
Water security challenges in urban Ghana, particularly in poorer neighborhoods like Old Fadama and Old Tulaku, are multifaceted and deeply intertwined with social, economic, and infrastructural factors. Despite efforts to improve households' water security, significant issues persist relating to sources of water, disruptions to livelihoods, perceived disenfranchisement from quality water, deprivation within excluded spaces, and the impact of exclusion on water rationing. According to the World Health Organization and UNICEF Joint Monitoring Program for Water Supply, Sanitation and Hygiene, as of 2019, approximately 86% of the population in Ghana, including Accra, had access to at least basic water services. But results of community surveys of actual experience using the HY scale suggest that as many as 2/3 of Accra households regularly experience water-related problems.
In Peru, accessing clean and safe water remains a formidable challenge due to geographic complexity, remote locations, and inadequate infrastructure. While urban areas fare better with up to 88% of city dwellers having access to basic water services, rural regions lag behind at around 68%. But as in Ghana, these official statistics hide much higher levels of experienced water insecurity. The prioritization of large mining operations over more sustainable activities has led to challenging water provision, with concerns over water quality and supply exacerbated by environmental accidents at mining sites. Consequently, water sources are often heavily contaminated, contributing to waterborne diseases among children and vulnerable adults. Despite efforts to improve water quality through interventions like lobes and filters, reinfection rates remain high, emphasizing the need for comprehensive approaches addressing water quality, hygiene practices, and community engagement.
The huge associated impact on physical and mental health underscores the urgent need for comprehensive approaches to water security challenges, particularly in low and middle income countries like Ghana and Peru. Despite official statistics indicating progress in access to basic water services, the reality of water insecurity, as revealed by the experience-based measures like the HY scale, remains stark. Interrelated issues such as inadequate infrastructure, unequal access, and the environmental contamination persist, impacting daily life and livelihoods. Effective solutions demand community-centered interventions informed by residents' experiences and participatory decision-making.